Welcome. My name is Kimberly Correia, and thank you for joining me today. I would like to begin with asking you a couple of questions. When you hear drug addict, do you think someone you don't know, or perhaps someone close to you? What kind of drugs do you think about? Marijuana, cocaine, heroin? Well, with today's drug epidemic on the rise, it's affecting many individuals. Doctors, lawyers, teachers, law enforcement, family members, even our own children. Today I would like to speak to you about prescription drugs. Is it possible that you or someone you love is addicted to prescription drugs? Most of us take prescription drugs only for the reason the doctor intended. However, prescription drugs are becoming abused more commonly. An increasing problem, prescription drug abuse can affect all age groups, but it's most common in our young people. The prescription drug most often abused includes opiate painkillers, sedatives, anti-anxiety medications, and stimulants. In recent years, there has been a dramatic rise in prescription drug misuse or abuse. This increase has led to more ER visits because of accidental overdoses and more admission to treatment programs for drug addictions. Prescription drug abuse is the use of a prescription medication in a way not intended by the prescribing doctor. Prescription drug abuse or problematic use includes everything from taking a friend's prescription painkiller for your backache to snorting or injecting ground up pills to get high. Drug abuse may become ongoing or compulsive despite the negative consequences. The National Institute of Drug Abuse says 48 million people ages 12 and older have used prescription drug for non-medical reasons in their lifetime. That figure represents approximately 20% of the U.S. population. Even when intended for valid medical or psychological issues, prescription drugs can be abused should they be taken differently than prescribed or taken by other individuals. Prescription drug abuse may occur in people who need painkillers, sedatives, or stimulants for treatment of medical conditions. Teens and adults abuse prescription drugs for many reasons, such as to feel good or get high, to relax or relieve tension, to reduce appetite or increase alertness, to experiment with the mental effects of the substance, to maintain an addiction and prevent withdrawal, to be accepted by their peers or to be social, to try to improve concentration in academic or work performance. The abuse of prescription drug leads to changes in how the brain looks and works. For most people, the first decision to take prescription drug is voluntary, but over time, changes in the brain caused by repeat drug abuse affect a person's self-control and ability to make sound decisions. While this is going on, the person continues to have an intense impulse to take more drugs. The earlier in one's life that drug abuse begins, the more likely an individual will become an addict. Drug abuse not only affects the individual, but also can have a far-reaching consequence that affects family, employment, personal health, healthcare systems, local communities, a society as a whole. If you or someone you know needs assistance and may have a problem with prescription drug, you speak to a family member, friend, coworker, counselor, your doctor, anyone who makes you feel comfortable. You may feel embarrassed to talk about it, but remember, it's easier to tackle the problem early before it becomes an addiction that leads to more serious problems. Remember, help is a phone call away, and in any crisis, if you are in immediate danger, call 911. I appreciate you listening. My resources for this information was Drug Abuse Systems, Facts and Statistics, National Institute of Drug Abuse, and Prescription Drug Abuse Symptoms and Causes. Thank you.